Okay. I have to leave almost exactly at the top of the hour, so I think we'll get started. But I'd just love to meet you all first. So if you're okay turning on your video, that would be great. I love seeing people alive and hoping that you're all alive. If you don't want to, that's fine too. But yeah, if you could each like introduce yourselves and kind of why, where you are and why you're here, like what you're interested in, I can make sure I can try and address those things in the webinar here. Paul, do you want to go first?
Sure. I'm Paul Keys. I'm an instructional designer at Meredith College, which is a all-women's liberal arts college in Raleigh, North Carolina, but we are starting a nursing program. And I know absolutely nothing about nursing education, but I've taken numerous digital storytelling workshops at StoryCenter. So when I saw this, I thought, and we won't have our first students till 2027, I think.
Oh,
So
cool. So I don't
yeah,
need to tell you about the whole process.
right. Yeah, so yeah, because we're in this true chicken and egg. You have to build a nursing school before the nursing school can be accredited. So it's a very
Got
big
it.
leap. It's a big leap of faith that you're asking students to come to a nursing school that hasn't been accredited yet. Yeah.
My brother is a PhD neuroscientist, and he says he has to do the same things. He has to do the research first and prove that it works before the NIH gives him a grant to do the work.
Right. Yeah.
So there you go. Um, cool. Thanks for being here. We'll definitely be covering some things that hopefully will be helpful to you. Rahele? Sorry if I didn't pronounce it right.
Yes. Hello. And I'm Rahele. I'm a
Rahele.
PhD. Yes, I'm a PhD student in nursing science and healthcare innovation at Arizona State University. I'm a second year PhD student, and I'm so interested in using storytelling for my dissertation. And I think about it during the past years. Honestly, I attended 2 different workshops under the supervision of my advisor. She conducted a workshop about digital storytelling for minority population about vaccination hesitancy. So that was
Oh,
so
I was just
interesting.
talking all about that in my last webinar last hour.
Yeah, that was so interesting. Yeah, I'm so interested to learn more about this novel way of conducting intervention for different population.
I'm just going to pop this up on the screen because I'm actually working right now on a vaccine hesitancy project here in Denver. I don't know if you know this project. Maybe let's see. I think it's here. And this is around vaccine hesitancy in communities of color. This is with a pediatrician at Denver Health. But you can look it up. Vaccine hesitancy and digital storytelling. It will be one of the first things that pops up, I think. The PI is Joshua Williams, but we'll get out of there. But yeah, lots of work around that. And then we also did a lot of work with the CDC around COVID vaccine hesitancy with the prevention research centers that you might want to take a look at. You probably already know, but anyway, any specific thing you want to glean or get from the webinar today that would be helpful to you?
Yes, I'm hoping to do how to create the things that I have in my mind, that create an intervention for caregivers using storytelling.
Oh, well, you're going to love that project that we're just rolling out right now because
Yes.
it's all caregivers. So
Yeah.
it's caregivers in high-risk communities of color, and it actually started before COVID. So it's all geared around an influenza vaccine, or they don't like to use the term flu shot anymore, but okay. Cool. Glad that you're here. And
Yeah.
Trisha and Joaquin, or Joaquin, I don't know how you pronounce it. You'll tell me. But we're just having people introduce themselves and maybe one thing that they'd like to learn from this webinar. Go ahead, Trisha.
Hey, you guys, happy to be here. You can see from my background, I work at Advocate Health. I have two roles. I'm a pediatric physical therapist, and I've recently studied adult learning and training. So now I sit just like Paul as an instructional designer for Advocate, and I'm part of a team that creates workplace education for all the teams, physicians, nurses, you name it, just the whole system. And so, through all of this, how do you change people's attitudes, write stories? This is the way. I believe in this type of work. And the reason I found StoryCenter was when I was studying adult learning, one of my thesis projects was maternal health literacy. And as I was studying that, I stumbled across the Illinois storytelling project that I think you featured. I was actually at the other course, and I stumbled upon it and I was blown away.
Wait, you were at the webinar just before this one? Yeah. Okay. So you saw that.
Yeah. So I saw it, but I mean, I must have watched every single video when I was working on my thesis. And I was like, this is it. This is the message. This is how it should be done for health literacy reasons. And then it's all just attitudes. It's just so great. And so I promised myself I would come back and to your organization and figure out how to take some workshops and do some of these things. So my goal is to be able to make these and maybe use it in workforce education, maybe patient education. I'm not sure, but I really love it. I really, really love it. And I'm wondering if I can take pieces of this and use it in my design work for healthcare education for the organization right now, and maybe grow into a different role down the road with this. So we'll see where it goes. So I'm excited.
Sounds good. And probably get into it, but make these stories, or do you mean make these projects?
Both.
Wherein people make stories, and that's something we'll talk about if you don't know that much about digital storytelling, is that we don't make stories for people. And you can use the tool set for that. You can do anything you want, but that's not what we do. We specifically train people to either make their own stories or run projects wherein people do the same work that we do, which is to help those people tell stories. But
thanks for reframing. That's good.
Yeah, that's just what we do. You can do whatever you want. And then great. So I'm glad that you're here. Sorry if some of this stuff will be repeated a little bit.
There.
Okay. And then is it Joaquin? Did I get that right? You're on mute.
Yeah, it's Joakim.
Joaquin.
I'm from Sweden, Gothenburg. I'm working in an organization for people affected by HIV, for everyone. And we are working with storytelling a lot. And yeah, I want to learn more in every angle I can sometimes. And yeah, that's why I'm here.
If you Google digital storytelling and HIV, you're going to see a whole lot of stuff that might be useful. Most of it either are things that we facilitated or that we trained people to facilitate. As with most digital storytelling projects, we kind of pioneered this very specific form and methodology. So most of the work out there at some point was touched by us in some way, shape, or form. Okay, well, great. I'm glad you're all here. Please pop in. There's not many of us here, so just interrupt me and throw questions out or say, hey, hold on a second, explain that. this is being recorded, so I'll send out a recording after. And yeah, so there's that. Let me go ahead and, I don't love doing PowerPoint, but I'll do a little bit of PowerPoint. Oh, actually, you know what? I'm not going to yet. I always like to start with a story. And this is a story. It's a little bit longer than most of our digital stories. It's around 5 minutes, and most of the stories that people make are around 3. But this is a story about being a nurse and also being a nurse educator, and how important stories are in educating nurses. So let me go ahead and load this one up. I'll just make a content warning always too, that a lot of the stories that people make in these workshops are personal. Some have little T trauma in them, some have big T trauma in them. Stories bring up things for people. It's why they're powerful, and also why they're dangerous. They bring people to places. So take care of yourself, step away from the computer if this brings up stuff for you that you don't want to process right now. Here we go.
One of the first words I learned in Bambara was abariga, come, eat. Because in Mali, you can't sit down to a meal without offering to share it. There was very little, but no one went without. Even strangers knew they'd have a place to lie their head. I helped deliver many babies before I ever became a nurse. Young, frightened girls, third wives, girls who'd had their genitals cut in local rituals, pushing silently on a dirty cement floor by the light of a kerosene lamp. The midwives' hands were wrinkled, swift, and capable. The babies tiny. The new mothers would lie on their own sheets on the floor and rest for a few hours before the sun crested the horizon. Then they would rise, gather their things, nestle the child against the small of their backs, tied securely with a strip of brightly colored cloth, and return to the fields to work. Because everyone depended on each other. Someone had to reap the harvest, collect the firewood, stoke the fire, pound the millet, stir the pot. There was little food and less of anything else, but no one went without. Everyone knew everyone else's name. The greetings could last for hours. Iniche, ikakenewa, somogobedi, dumogomorao, nse. After I became a nurse, I belonged to a community where many experienced homelessness. They were easy to pass without acknowledgement. Even people who gave money would do so hurriedly, without looking up. Sometimes I did too. But perhaps because I'm a nurse, it was important to me to learn their names. Sally, with the fuzzy kitten who lived in her jacket. Iceman, who got his nickname from the cubic zirconium earrings in his ball cap. Silent aging William, with the sad blue eyes and the soft voice, who never smiled. He always helped. Each week we worked together to serve food to others in the same situation. My infant daughter passed out the spoons. They learned her name, and the older women, some grandmothers and great-grandmothers, would greet her and cuddle her, and she would laugh and laugh. We would sit together on benches and talk about life. And then life got harder. I moved to a new place. I went back for the first time for a work thing, taking place a few blocks away where I used to hang out. The bench was hard and cold beneath me. The space echoed around me. I was lost inside my head, worrying, gathering my reserves to return to work. I was running on fumes, and I knew it. Then I was aware of a quiet presence behind me. William, aging, sweet, soft-spoken William with the drawn-in mouth. "Rachel," he said. He leapt to his feet, a smile stretching across his face, and his arms wrapped around me in a bear hug, like a human battery charger pouring the life back into me. I felt restored. One of the first things any new nurse learns is to know and use a patient's name. Not their illness, not their procedure, not their home address or lack thereof, but their name. The motto of a very famous school of public health where I used to study is saving lives, millions at a time. And that's great for those anonymous millions. But as nurses, we know names, individuals, and the stories that go with them. It is a simple but sometimes radical act to know a name. I'd like to think that for most nurses, this practice continues, even when we're not wearing a hospital ID badge. I'm still learning names. Hi. My name is Rachel. What's yours?
Okay. I was like, take a breath. God, these stories get me, and I've seen them 500 times. And what's interesting is that people that come into the workshop, even though they may have told a version of this story 500 times before at lectures and in classes and whatever, they start crying at their own stories sometimes. That's also a big part of this work, is that it affects, it's not necessarily just for audience. And if you're thinking about nursing education, it's not necessarily for other, that it's going to have an impact on people that watch it. It's that it has an impact on you in the making of it. And that goes specifically towards nursing education. If you think about it as like getting people to be reflective on the work that they do, how they're going to handle the work that they do, what caring means to them, how that might be shifting, how do they handle their own ethics around what it means to care and what then the system requires of them. And I think the term is moral injury that happens there, not being able to do things at the ethics level that's important to you because of what the system demands. So how do you handle that so that you prepare nurses for the environments that you're going to go into? And some of that is around not just saying, well, it's going to be hard, but here's how I dealt with it. Watching a story of someone who dealt with it, a professor like this sharing this story with their students and saying, this is what I bring into my work. The importance of knowing people, that this is what we try and do. What is it that you're going to try and do? Have people either respond with discussion or with making their own stories around, maybe it's an ethical dilemma. Maybe it's, where does your sense of caring come from in your life? What are the appropriate boundaries between, I think for so many nurses, being a nurse is not just a job. It's a part of who they are. And so how do you stay safe? How do you battle burnout, compassion fatigue, vicarious trauma? All those things are some of the things that I think when we work with educators, they're like, gosh, I wish we had more of this in our education. Yes, are the technical things vital? Yes, they are. And you can teach people all of those things and they're going to quit 2 years in because they're not going to know how to handle the work that they do. So a lot of schools that we work with, and not just schools, we work with organizations, and I'll kind of show some of that too. Nursing organizations, or I work with Nurse Family Partnership. If you don't know them, they're a public health nursing entity that has offices in every state in the country. It's home health nurses. We're going to watch a piece. Home health nurses who work with first-time parents, almost like 99% first-time moms. Dads are not present. That's part of That's part of the problem, maybe, who live with significant risk factors, that being one of them, poverty being another. It's a Medicaid funded program. So sometimes we're working with entities like that, and schools that are going to prepare nurses for doing that kind of work. You're going into people's homes. The stuff that you're seeing it's the stuff of nightmares. And so how do you do that? And why? All right, let me go back. Hopefully we'll have time to watch one more story, probably from that project itself. Let me find that PowerPoint again. Okay. So just really quickly, I encourage you, I think everyone here kind of knows you all know a little bit about digital storytelling. So just the very specific things are that it is a community participatory media process where people themselves in group, whether it's anonymous group that people don't know each other and they're coming together, or people absolutely know each other, whether it's a group of nurse educators, which actually that story that we just watched was all nurse educators at UMass Amherst learning digital storytelling to bring into the classroom, and part of that process, not just learning about digital storytelling, but making your own story first before you try and teach others. So that's also part of our ethics, is you got to do the work yourself. Do that. And hopefully that is a wonderful thing for you and not a weight. But I think that's part of good ethical practice. So individuals in group making their own stories as much as possible from the very beginning of what story do you want to tell? What's your understanding of that story? How to write it, how to record your voice telling that story, as you heard in that piece, that voiceover, what images you might use that quote unquote go with that story. And think about the types of images that she used in that piece and how they often did not show the exact thing that she was talking about, but were somehow adjacent at times. Somehow they absolutely were a picture of what she was talking about. But I was running on fumes and I knew it. It's a picture for that. So then learning the video editing software themselves and putting the story together themselves, and then using the story however they want to use the story. Or if you're working with an organization, how does the organization, like Nurse Family Partnership, want to use these stories? And I'm going to show you a really cool approach or project that I did with them in terms of how they're using the stories within their organization. So that's just like a quick background on what digital storytelling is. This particular project, which is called Nurstory, if you haven't gone, I think I sent it out in the email with the Zoom link, but Nurstory is a project that I run for the past 16 years with a nurse and nurse educator named Sue Hagedorn. And we also have a kind of a nurse story scholar who does a lot of research, who's Dr. Rayanne LeBlanc. And if you go to the Nurstory site and look under resources, you'll see some of the papers she's published around using digital storytelling in nursing education. I'll share that webpage with you as we're kind of going through this webinar. So we'll talk a little bit about all that. So I think I'm just going to skip over these because I pretty much talked about them. But this really is kind of an activist push for people to tell their own stories in screen media, which might seem totally normal now, but back in 1993, people didn't do that. And they certainly didn't publish their own video stories because there was no way of really doing that. So things have changed a bit. But we're still kind of very focused on people telling their own stories. They might include other people, as the story that you just watched did. They might include a nurse's story about their experience with a patient, their experience with another nurse, something from childhood that came up. Like I have a nurse who told a story about when she was 10 years old, her mom got breast cancer, and she, at 10 years old, became her nurse. She was the one giving her mom injections every day. She was the one taking care of her, and that's how she came to nursing until her mother passed away. I'm going to skip over this. There's the product that comes out of these workshops. That's a digital story. And then there's the process of digital storytelling. Just move these away. This is kind of a little bit about what I just spoke about. These are some of the things that digital stories are used for in nursing education, highlighting gaps in the system, near misses. I did a lot of work with flight nurses. We did 7 workshops with flight nurses who had survived the crash of their aircraft, mostly helicopters, and or near misses, and what as part of a research project on what safety looks like, because even though all of the helicopters, for example, have become more and safer and safer, our culture has become more and more dangerous. So actually more people are dying from medical flight crashes than ever before. Why is that? So we did a lot of workshops about how hard it is to communicate sometimes, and what does safety look like to people. You can read all the rest of these. I already just talked about how it's a participatory media approach where people make their own stories as much as possible. That's really important. Agency is super important in our process, because agency is what really changes people within the process itself. Having agency over a story that you've lived, deciding how you're going to tell it, what you're going to tell, what it means, is also a lot of growth in that. You're not just coming in, for example, nursing students are not just coming in and just telling a story that they've told a million times before. Because it's group process and people are sharing their ideas for the story, oftentimes they end up telling a story that they didn't even know. Or it might be that they're telling a version of the story that they didn't know. Like they're like, oh, and this patient said this to me, and this is what it meant. And then someone else in the workshop is like, well, have you ever considered that they might have been talking about this? And then all of a sudden, that person goes, holy crap, I never thought about that before. And all of a sudden, they're telling a version of the story that they had never considered. That happens all the time. Sometimes that happens from just hearing oneself tell the story out loud and then saying, wait, that doesn't sound right. Or I've never been asked to sit down if the workshop is 3 days long, I've never been asked to sit down and figure this story out and what insight I get from it. This one, often what becomes like one interaction. These stories are often short, 3 minutes. They're not a story about your entire nursing career. They're a story about one particular moment, usually, and the impact that it maybe had on you. So we're not often asked to do that, nor do we have the space in our lives to do that. And these workshops give people the space to process those kinds of moments and figure out what they even mean, or why they've been carrying that moment around for 10 years or 20 years or a week. I'm not going to go over this necessarily. There are things that go on in the workshop. We encourage people to think about how they're going to tell the story, both the written story that becomes their voiceover, how they're going to voice that story, how much emotion are they going to put in. You heard some of that in the story. You hear emotion in every story, just different emotions. But how they're going to find these moments that are going to tell the story for them. You heard some of these moments in this piece that we just watched, such as this guy in the park giving her a hug and him knowing her name and her knowing his name, and a moment in Africa of delivering a baby, and lots of different moments. And then how to use visuals, how to use music or the sound of an emergency room, how to use all this different media to create a really powerful piece. Hide this little video thing. I'm going to pop through this. I think one of the things that you can do if you want is go to the Nurstory website. On the very front page, let me go ahead and share this. I think it's here. Can you see the page now? Hopefully. So on the very home page of Nurstory, there's a play button, and that's a 15-minute documentary where we actually brought cameras into a workshop itself. We don't normally do that because we want it to be a really safe space for people. And having a bunch of cameras and microphones hanging around is not usually comfortable for people. But in this case, we prepped people for this and they opted into being part of this workshop, and we actually recorded it. So you can kind of see what happens in one of these workshops and the impact that it has on people. And this is one of the workshops with Nurse Family Partnership. I'm going to go back to the PowerPoint. Any questions so far, though? Okay, maybe I'll share. Let me, I want to go ahead and share one of those stories from Nurse Family Partnership, actually. So let's take a look at this one. There are so many good ones. Eesh. Okay, we'll do this one. I haven't showed this one in a long time. Okay, here you go.
When I was little, I faked stomach aches to escape the chaos of the back seat on family vacations, lying on my mother's lap, listening to the sounds her stomach made as she rubbed my back. My mom was the gentle and calm shelter from my father's loud and sometimes violent storm, and my 7 brothers and sisters all learned different tools for self-preservation. Mine were to lay low and avoid conflict. He yelled, I shrank. Carrie's path to NFP included a laundry list of physical and psychosocial risk factors, but it told nothing of how she got there. She had been adopted at 10 months, witnessed her adoptive parents' difficult divorce, was married at 16 to a violently abusive man, developed congestive heart failure and untreated diabetes, and was mostly written off by her doctors as being difficult and uncompliant. But Carrie's deepest wish was to be a mother, and she told me over and over that Jamie's birth saved her life. She lived way east of Denver in a rented mobile home she shared with her husband, baby, and a motley collection of dogs. That day, my knock was met only with barking, and as I pushed open the door, I was assaulted by the stench of sour milk, dirty diapers, and too many dogs in too small a place. The baby was strapped into his swing, a half-empty bottle of curdled milk on his lap, and Carrie lay sprawled on the couch, barely responsive. I didn't know at that moment that Carrie was addicted to the painkillers that had been prescribed for her chronic pain. All I knew was that something was terribly, horribly wrong, and her motherhood journey almost ended in that moment. She never knew it was me who made the report of neglect to Child Protective Services, but it was her reason to get sober. And we celebrated her graduation almost 2 years later at a park where Jamie ran and climbed and laughed, and so did Carrie and I. When I was a kid, all I wanted was to be loved and heard and seen for all I was. And maybe Carrie's path wasn't all that different. Maybe none of ours is.
I'm gonna stop it there. Any thoughts about that one? Or comments on it?
I really liked the images that were shown because I don't think they showed anything violent or terrible, but it was just enough to tell the story, which was hard.
Yeah. Yeah. Like you can just see the trailer, but she talks about what was going on inside. And when doing work in healthcare, you know, that's one of the things that we run into with doing this work is you can't, you know, is HIPAA violations, especially when you're talking about a patient client, you know. So that's again what we talk about not necessarily needing to show the exact thing that you're talking about on screen. That was a really good example of just talking about all the interactions that were going on in there. This nurse is actually a supervisor at Nurse Family Partnership, and she uses this story. They have something called reflective supervision with their nurses and supervisors. Every single week, you spend an hour with your supervisor reflecting on some case or on some client that you're working with that you're struggling with or that you want feedback on. And what they asked me to do, and we'll see this in a second, is create modules for them to use, which I'll show you. Why don't I just show you? So if you go to, where is it? It's on resources. I was there. Let me go back. So here are some resources. One of the most important resources for you all, my guess is, as thinking about Nurstory and education, is going to be this free educator's guide that goes over some things that I'm not going to go over today, which is like all of the theoretical underpinnings of why doing storytelling, reflective storytelling work is important in nursing education, like very specific. So Dr. LeBlanc, who helped write this guide along with me, goes into some of those theoretical underpinnings. So when you're trying to justify this kind of work to your administration, that will be hopefully hugely helpful to you to know kind of where the benefit of caring science and, you know, where it comes from and how it's useful to in developing nurses for the field. But up above, you can see, I'm going to show this full screen, I think. Hopefully you can see that now. So this is these reflective storytelling modules that are basically little mini, well, they're not digital storytelling, but storytelling workshops, very small ones that Nurse Family Partnership, during COVID, I was doing weekly 1-hour sessions for wellness, for nurse wellness for them. Like they had free yoga online for all their nurses who were not able to go out and do their work, which was going to people's homes and helping them become mothers. And they were not able to do that. And so they're sitting there on the computer all the time doing telehealth visits, and they needed process not being able to do the work in the way that they wanted to. One woman talked about how painful it was to not hold a baby for 2 years. That's what she did. She held babies with the moms she worked with, and she didn't touch a baby for 2 years, and how difficult that was for her to tolerate. But these storytelling modules, first it has kind of some suggestions for for creating these spaces for reflection. And then each of these kind of pages, like you'll see module 1 there on the right, they start with a reading or a poem. Then you watch a story, and there's a link to the story that goes with that kind of prompt, which was Small Heroes. Then there's a writing prompt for people to do for 15 minutes about, in this case, a small hero that you've discovered in the past year. It could be something that relates to your work. In this case, we had these all, they could take it one of two ways. It could either be something to reflect on about the work and how hard it was as a way to process that and get it out, or it was an escape from the work, and you could think about how to answer this prompt about anything other than the work that you were doing. So all of these prompts work in two ways. And then there were discussion questions that had to do with this kind of story in nursing or in not nursing life. So you can take a look at that if you want. And there's all these different modules that I wrote, and each of them has a digital story that goes in them. Each of them has a poem. Each of them has discussion questions. And a lot, things like this are exactly what nurse educators bring into the classroom when doing this work with students. And if we go down, there's the Nurse Educator's Guide. And if we go, here's another module that Dr. LeBlanc uses. So learning methods in nursing education, you can launch that. And then here's a bunch of papers and research around using digital storytelling in the classroom. And there's probably more since then. I just haven't updated. So let me go ahead and go back quickly to the PowerPoint questions now. You guys are easy, or I'm super boring. So this is the kind of thing that I'm just going to skip over. This is what is covered in that Nurse Educator's Guide in great detail. But these are the types of reasons why you might use digital storytelling or use it either in reflective practice, like on the job, or certainly in nurse education. But again, nurse education could mean nursing school, but nurse education happens forever in nursing. Hopefully you're always learning. These are some of the theoretical perspectives and underpinnings of this work. And this is part of the effective, part of the taxonomy. This is what I'm talking about. Dr. LeBlanc can actually speak to this a lot better than I can because I'm not a theorist. I'm more of a practitioner. He is both. But this is how this work works. And here are some of the activities that she might bring into the classroom and why. I hate reading slides, so I'm not going to do it. But I'll let you take a look at this. And again, all of this is repeated in that educator's guide. And so sometimes like selling an administration on doing something like this that feels soft. Like, oh, we're just going to tell stories. And like, well, we're not going to do that. That's not a good use of, classroom time and student time. But really, it's becoming more and more vital as burnout becomes more and more prevalent because of the pressures in the system that you know better than I do about people's ability to actually care, the overload that that nurses have. how many patients they're asked to take care of, how little time they have for reflection, this kind of stuff gets more and more important. Otherwise, they're burning out in a couple of years and they're gone. And that's what's going on in nursing right now is, and it's part of a safety issue, is that there's so many young nurses and no one to kind of train them appropriately. They don't have mentors on the job because they've already quit.
I have a question. How, when I go to the hospital and educate the nurses there, how much time do you think digital storytelling can be? Can it be 1 hour for one time and then
It really depends on what you're
5 months
trying to
later?
do. So there's making of digital stories as using digital storytelling in nursing education, but there's also all these other uses, which is just watching stories and having a discussion about them. What issues do they bring up? And how would you handle that ethical dilemma or moral dilemma? And then these 1 hour sessions that I created are really just for people to do some writing and then share that writing back to the group. And then if you want to go further with that, you teach people video editing software and whatever, and they put the pieces together as digital pieces and record their voices. In that case, we have the methods that we use, but when it comes to breaking that out into like academic uses in the classroom, then that gets strung out for like an entire semester or something like that. Like, here's your assignment for this week. You're going to write the first draft of your piece. And then next week, you're going to share it with other students. And then the next week, you're going to bring in a second draft. And then the next week, in our in-person workshops, they're usually 3 days long, all day long. So 24 contact hours, more or less. When we do our online workshops, when we do them, and I did them with Nurse Family Partnership, it's 6 weeks, a 2-hour session per week. So that's half the time, 12 hours instead of 24. But in between those sessions, we have office hours and students come to us and they're like, well, here's my script. What do you think about it? What should I do, etc. So, and then sometimes we do workshops that are 1 day long, and it's just nurses making stories using one picture only. It's called a snapshot workshop, where they reflect on one image. There's a really powerful one about a nurse who also became an addict on the job. And then lost her nursing license and got clean, and now works with patients who are often addicts, and what she brings to the job now, and what the type of understanding that actually she brings to the job, and working with those patients having been an active addict herself. I'm not gonna show it, but I want you to watch that story if you have time. I'm just gonna put a link to it in the chat right here. Go ahead and click on that, but don't watch it now. Watch it after and just see how amazingly, hopefully, kind of captivating even just a single picture can be. Let me go ahead and go back to that. I'm just going to kind of wind this up pretty quickly. Again, because all of this, and this is hopefully is really useful. It's basically giving you, the syllabus and curriculum for bringing, and even rubrics for how might you grade digital stories or that process for students. So they analyze digital stories themselves and, write papers about those digital stories. So again, yeah, this type of stuff you can just take it straight out of the educator's guide. So I'm going to just end the process there. And again, if you go to the website Nurstory, and there's that documentary, but then let me go ahead and just show you in case you haven't seen. I know it's kind of dumb, but so you all can do this, but there's just a page with like lots of different stories from different projects. Here are just kind of featured ones from different projects that I put up there. Different clients like Colorado School of Nursing. Here are the medical safety stories from the flight nurses. Here's aging in the nursing workplace for nurses as they're getting older, and what are the issues there that they encounter, including stigma. Here's a workshop we did with all forensic nurses and dealing with the types of people they work with and the types of stories they hear. Here are the UMass social justice stories, including the one that we just watched. What's your name? This is from Florida Atlantic University using Nurstory and nursing education. And here's Nurse Family Partnership, a bunch of them. And some documentaries about this, which again, this one is the one that's on the homepage. If you go to projects, you'll see each of those projects themselves, and like kind of little write-ups of those projects and then stories from those projects. And resources you already saw. So that's pretty much it. Questions, things I can answer?
You know, a lot of these stories, we can access. Do we need to, if we wanted to use one of those wonderful stories, like in a teaching, would we need to get permission from you or the
No.
author?
No, you don't. I mean, people have access to us, and they've all consented to having their stories in public. Some people haven't consented and their stories are not out there. So like actually one of the Nurse Family Partnership nurses just recently asked for her story to be taken down. She just didn't want it out there for one reason. I think it was like political. She did her story about, she works with again those very specific populations, and she's from the South, and her entire family are let me say, politically, they don't believe in serving the underserved. And her whole piece is about that and about her family not supporting the work that she does. And for a while, she didn't want that story out there because it was very, I don't know, problematic in her family. So, but most people want their stories seen. They're very honored by having their stories watched and used. And so, yeah, you can go ahead and do that. If you ever want to contact one of the storytellers, you can get in touch with me and I can ask them if they wouldn't mind you getting in touch with them and asking them questions about their story, or asking them to come to one of your classes and speak about what it was like to make a story like that. Things like that. All the people that take the workshops are usually very just proud of the work that they've done. Anything else? Paul said that he's already taken some of our workshops. So I don't know if anyone else here has. Well, Relea, you have, or at least you've taken some digital storytelling workshops. But we have public workshops all the time, so you can sign up. We have in person, and then every month we have one of those 6-week online workshops where you make your own digital story. I think that's hugely important and part of good ethical practice, to go through the process yourself first, to know how you might want to bring it into your work, whether it's in the classroom, in training at an organization, whatever. I think it's also just really fun, and for many people, life-changing to participate in something like that. So you can look on the website on StoryCenter.org under public workshops and see if one works for you.
Yeah, I did it and review all available online workshop before, and scheduling for attending one of them conducting during the summer, next summer. So hopefully I can do that. So that would be so great that I can starting my dissertation and use the story to create, use the story that I want to create for my dissertation and put all of them together, maybe be in the right path and do good things, impactful for the other ones.
Yeah. Oh, yeah. One thing I was gonna say also was that we also have, so we have a course where you make a digital story, and then after that we have a certificate course, which basically is like a train the trainers. So if you, it gives you even more information about bringing this into the classroom and how to do it. I'm also, hold on one second, because I want to just shoot you a story about a researcher, a nurse educator and researcher. And this is a story about the research she was doing. It might, I don't know, might be interesting to you. That's from Florida Atlantic University. And then the other option is to bring us in. As you've seen in these projects, this is when a school or an organization hires us to come in and run a workshop. Sometimes we'll run them with nurse educators. Sometimes we'll run them with nurse educators and their students at the same time. Think about how humanizing that is, to have your teacher or professor or whatever be a student at the same time as their students are, and learn this thing together and share stories of nurses in practice with young nurses who might not be in practice yet, and how rich that kind of, I guess, intergenerational maybe, or I don't know what you want to call it, different levels of profession together. We actually have even had workshops with nurses and physicians about the rifts sometimes between those two communities, and trying to work together well. So all those things are possible. And yeah, we fly out and run these workshops at schools or in organizations, or we can run them online as well. So I guess just be in contact if any of that stuff is interesting to you. I think you all have my email address. I'll put it in the chat again, daniel@storycenter.org. I'm really happy to connect you with Dr. LeBlanc if you'd like to speak with her further about some of the underpinnings and how she uses it in the classroom. Normally I have her present along with me, so you can ask her direct questions, but she wasn't available this time. But I just want to thank you for coming, and please email me with questions. We can get on Zoom and talk about it and what your interests are, things like that. So I guess thanks for your interest in this work. I hope you get a chance to do it and integrate it into your work, whether it's with us or without us. Super important.
Thank you so much. That was so amazing for me.
Good,
Yeah.
good. I'm glad it's helpful. Plus, it's always just fun to watch a couple stories.
Yeah.
Or moving.
Thank you.
Yeah,
Really
thank you.
interesting.
Nice to
Yeah.
meet you all.